Hello everyone, I'm Clesia Fernandez and welcome back to my nursing lecture series. In the previous class, we discussed about the principles of growth and development. In that class, we learned how growth and development occur in a systematic and continuous pattern. But if we observe children around us, we can see that not all children grow and develop in the same way. Some children may grow faster, some may grow slowly, and some may learn certain skills earlier than others. So the question is, what causes these differences in growth and development? And the answer is that growth and development are influenced by many factors. And these factors may include things like heredity, nutrition, environment, health status, and many other conditions around the child. Right. So, as nurses, it is very important for us to understand these factors. Why? Because it helps us to identify normal growth, recognize problems early, and guide parents properly. So in today's class, we are going to discuss about factors affecting growth and development. And before we start, if you haven't watched my previous lecture on principles of growth and development, you can check it in the description below. And if you find these lectures helpful, please like the video, share it with your friends, and subscribe to the channel for more nursing lectures. Now let us start today's topic. Now let us learn these factors affecting growth and development one by one. So the first factor is genetics. Okay, so a child's growth and development is mainly influenced by the genes that is inherited from their parents. Okay, so because of genetics, what happens is children often look similar to their parents. For example, genetics can influence height, body structure, skin color, hair color, and eye color. So if the parents are tall, there is a higher chance that the child may also grow tall. In the same way, other physical features can also be inherited from the parents. So that is about genetics. Then the second factor is nutrition. So proper nutrition is also very important for the healthy growth and development in children. So if the children need proper and balanced food so their body and brain can grow properly. When children do not get enough nutrients, it can affect their growth, and that condition is called as malnutrition. Okay, malnutrition can be of two types, that is undernutrition, where the child does not get enough food or nutrients, and there is overnutrition. So what do you mean by overnutrition? Where the child eats too much unhealthy food. So because of poor nutrition, children may develop problems like stunted growth, weak immune system, and childhood obesity. So proper nutrition is also very important for a child's healthy growth and development. Now let's move to the third factor, which is environmental factors. So the environment where a child grows up can also affect their growth and development. And if a child is exposed to pollution, harmful chemicals, or toxins, it can negatively affect their health. So poor living conditions such as lack of clean water, poor sanitation, overcrowding, and pollution can also slow down a child's normal growth and development. So a clean, safe, and healthy environment is very important for children to grow properly. Now let's talk about the fourth factor, which is health and illness. So a child's health condition can also influence their growth and development. So children who suffer from chronic illnesses, then frequent infections or other health problems may have slower growth. For example, if a child is often sick, the body may not get enough energy to grow properly, right? So this can affect their physical growth and overall development. So therefore, maintaining good health and providing proper medical care is also very important for children. Now let's look at the fifth factor, which is physical activity. So physical activity is very important for healthy growth and development, because children should be encouraged to play, run, and participate in physical activities so that it helps them to build strong muscles and bones. So regular physical activity is also very important for the child's good health. Now let's move on to the sixth factor, which is social and emotional factors. A child's social and emotional environment is very important for healthy growth, because children who experience stress, neglect, or abuse may have delayed or impaired growth and development. So, for example, A child who grows up in a stressful or unsafe environment may not grow physically or emotionally as well as a child who feels loved and secure. So, this shows how emotional well being affects overall development. Then, the seventh factor is hormonal imbalances. So, hormones are chemicals in the body that control growth and development. So, hormonal if a child has hormonal imbalances such as problems with the thyroid hormones or growth hormones, it can affect their growth. For example, a lack of growth hormone can cause short stature, while excess hormones can sometimes lead to abnormal growth. Then the eighth factor is age and gender. So boys and girls grow differently, okay, at different rates. For example, girls usually start puberty earlier than boys, and boys generally grow taller than girls by the end of adolescence. So a child's age and gender naturally influence how and when they grow. Now let's move to the ninth factor, which is cultural factors. Okay, so a child's growth and development can also be influenced by cultural practices and beliefs. Okay, so these cultural practices and beliefs can also impact the child's growth and development. So, what are these cultural factors include? These include dietary habits, parenting practices, and social norms. For example, for dietary habits, some examples are like some cultures may prefer or may have certain food that children eat or avoid. Then, under parenting practices, how parents raise, discipline, or care for their children can also affect the growth of the child. Then, social norms, those are cultural expectation that also can influence a child's emotional and social development. So, culture can shape both the physical and emotional growth of a child. Then the 10th factor, that is antenatal factors. So which means factors that affect the baby before birth, and those factors are again genetics. So here a baby's growth and development can be affected by the genes that they inherit from their parents. For example, body shape, height, and risk of some illnesses. Then there is maternal health and nutrition. Now what is this maternal health and nutrition? So if the mother eats healthy food and avoids harmful things like alcohol or smoking during pregnancy, the baby will also grow better and healthy. Okay, so that is about maternal health and nutrition. Continuing with the 10th factor, that is prenatal healthcare access. Okay, so the regular checkups during pregnancy also help to find and treat problems early, so which keeps the baby also healthy. So that is prenatal healthcare access. Then there is maternal stress and mental health. So if the mother is very stressed, okay, or anxious or sad during pregnancy, it can affect the baby's growth and development. So a mother's health, nutrition, mental well-being, and access to proper medical care during pregnancy all play a big role in a child's growth. Now let's talk about the 11th factor, that is perinatal factors. Now what do you mean by perinatal factors? So perinatal factors are the things that happen around the time of birth. So under that, first one is labor and delivery. So if the labor is very long or there are problems during birth like the need for a C-section, it can affect the baby's health and development. Okay, then second one is birth weight and gestational age. So babies born too early or with low birth weight may have health problems and might face challenges in learning or growing properly. So that is birth weight and gestational age. Then third one is birth trauma or injury. So sometimes what happens is babies can get hurt during birth or may not get enough oxygen, and this can lead to long-term problems with growth and development. Then fourth one is neonatal health and care. So after birth, the baby's health and care are very important. So babies who need special care, like in the NICU, or who have problems like jaundice or infections, may have delayed growth and development. So the way a baby is born and cared for in the first few days of life can have a big impact on their long term growth and development. Next one is postnatal factors. So the postnatal factors is nothing but under that this is after the delivery. So here nutrition and breastfeeding is very important. So giving babies healthy food and milk, that is breast milk or formula, helps them grow strong, build their brain and stay healthy. Then second one is parenting and caregiving practices. So when parents love, talk to them and play with their children, it helps them feel happy and safe and learn better. Then third one is early childhood education and stimulation. So going to school, playing and doing fun activities helps children think clearly, talk well and get along with the others. Then there is healthcare and immunization. So regular doctor visits are also important. Vaccines help protect children from sicknesses and catch any problems early. That means it prevents from catching any problems. Then there is environmental exposures. So that means living in a clean and safe place away from smoke, dust or chemicals also help children grow up healthy. So in today's video we learned that a child's growth and development are influenced by many factors, and these include genetics, nutrition, environmental factors, health and illness, physical activity, social and emotional factors, hormonal balance, age and gender, cultural factors, antenatal factors, perinatal factors, and postnatal factors. So all these factors work together to help a child grow healthy, strong, and happy. So understanding these factors is very important for parents, teachers, and healthcare professionals to support proper growth and development in children. Thank you for watching today's video on the factors affecting growth and development. Make sure to like, share, and subscribe if you found it helpful. In the next video, we'll learn all about developmental milestones in children. So stay tuned. Thank you.